Let me say good afternoon to everyone, and thank you for being here today. And today, standing with Councilmember Pollard from District J, and Councilmember Cisneros was here but had to leave. And then I will introduce everyone in a few minutes. Of course, Marvin Odum, who is the Chief COVID Recovery Officer for the City of Houston. Chief Pena is also present with the Fire Department, and Chief Bunick, Office of Emergency Management, and Dr. Purse is also present. Today, the City of Houston Health Department reports 141 new cases of COVID-19. That's 141, bringing the total case count in the City of Houston to 6,188. Let me underscore that as we do more testing, and we are doing more testing, I'm not surprised with the numbers continuing to rise. That will be a part of it. The total number of deaths in the City of Houston has increased now to 123. That is four new cases that we are reporting today. With regards to these 4 new death cases, it is a white male in his 90s with underlying health conditions who passed away on April the 28th. A white male in his 70s with underlying health conditions who passed away on April the 12th. A white male in his 70s with underlying health conditions who passed away on May the 13th. And then a white male in his 70s with underlying health conditions who passed away on May 18th. Each positive coronavirus case and each death in our community represents someone's loved one, a husband, a wife, a father, a brother, or a sister. And that is why it is important that we do not forget that we are still in a public health crisis. The pandemic has not ended, and the threat to our hearts, to our health and safety is not over just because more businesses are reopening. In fact, this is the time we need to double down and to do more to stop the virus from spreading. Every day, when I come before you right around this time, I give you the numbers. 141 today, 4 new people who have died as a result of COVID-19. And in many ways, when you do that, it can be almost sterile, just a number without a face, without a person, without a name. But these are persons, and these are families that are being impacted in many cases for the rest of their lives. I want to talk about a particular person today, and I've asked his family to come and join with us. On February 18, 2020, the Houston Firefighters Relief and Retirement Fund held a celebration to recognize Tony Pierce, 20 years of service. 2 months later, literally 2 months later, Tony passed away as a result of COVID-19. And that is how quickly life can change if you get sick with this virus. Tony was not just any person. For several of us in this room today, we knew Tony. Tony was president and head of Alpha Eta Lambda, Phi Alpha Fraternity Incorporated, which is my grad chapter in fraternities for which I am a part. And there are several employees of the City of Houston that is a part of this fraternity and part of this particular chapter. Tony is no longer with us. In fact, on Sunday, there was a special virtual memorial tribute that was being paid to Tony, and I had the opportunity to present to him a proclamation honoring Tony for the life that he led. Gayle, his wife, is here today, along with his daughter, Nia. They were a part of that virtual memorial celebration on Sunday. Gayle said some things during that memorial that really brought things home. And no matter how many times I stand before this podium and talk about the importance of face coverings and masks and social distancing, sometimes you hear it so much from me. It's just another message coming from the mayor of the City of Houston, and you would expect for him to say it. I've asked Gayle and Nia to be here today to speak briefly about Tony and the importance of us taking special attention, paying special attention, and doing things that did not save Tony, but possibly can save so many, many, many others. And so I want to thank Gayle and Nia in advance for them being willing to come and stand and be a part of this press conference. Gayle, let me call you up. Gayle Pierce.
Good afternoon. I'm coming to you as a wife, a mother, a concerned citizen, and someone whose heart has been severely broken. COVID-19 has impacted the lives of my daughter and I deeply. Who knew that when I took my husband to the ER on March the 28th, that would be the last time that I would speak to him face to face? Thank God that I was able to tell him that I loved him, and that was it. Because as you know, families are not allowed in the hospitals. And so my only communication on a daily basis was with the doctors and the nurses at the hospital. And with that, I kept an extensive journal outlining day to day, hour to hour on his recovery. He fought for his life for 25 days, sedated, intubated, and ventilated, on a ventilator. COVID, which is the infection that took over and contributed to the pneumonia and the respiratory issues that he was facing. COVID-19 is real. Contrary to what we're hearing on television, it's here to stay, with or without a vaccine. It's just like the flu virus. It's going to come back year after year, maybe different strands or whatever, but it is for real. It makes me mad every time I go to the store and I see dozens and dozens of people walking around unmasked. I mean, it's just like we're opening up the businesses, we're opening up the state, and oh wow, this is over. We now can go to the beach, thousands of us, and just sit on top of each other. I understand that we need to support our businesses. I understand that people need to work. But why can you not wear a mask and protect yourself and others while you're doing this? I'm not getting it. I don't understand. My husband left behind family. He left behind his fraternity brothers. He left behind his co-workers. He left behind rodeo committee members, just hundreds of people that knew him. And to me, it's just unfair. We're struggling. We are really, really struggling. I now have to take on a dual parent role. I now have to take on responsibilities at home that I never had to do before. I'm thinking in the future, when our daughter gets married, her dad's not going to be here to walk her down the aisle. Okay? He's not going to be here for his grandchildren, which he had already named himself Pop P. And is this really what you want your family to have to go through? This is not what we wanted. He and I had retirement plans. We had things that we were going to do. And so now that's over. I would try to push on by myself. Stop being macho. Stop trying to be cute. Put the mask on. You can get masks that match your outfits. But the bottom line is you need to mask up. I know it's getting hot, but there is a mask out there that will get you through the summer. So please, I beg you, I don't want anybody else to have to go through this struggle. This is not fun at all. Thank you.
Gayle, let me thank you. Let me thank you for your remarks, and Nia, let me thank you. Tony was our alpha brother, and there are a number of alphas that are in this room. And I think, like we've said before, this is a journey you won't have to go take alone. And what you have said today, Tony is not here, but your words and what you've said can benefit so many, many others. And so let me ask you all, please mask up. And if not for yourself, for your family members, for your friends, for others, let's recognize that there are some things that we can do to protect one another. So thank you so very much. Thank you, Gayle. Thank you. Thank you, Nia. Monday, May the 25th is Memorial Day, and every year we remember and honor the men and women who have sacrificed for our country. And this year, some activities have been canceled because of COVID-19 pandemic. But like every Memorial Day weekend, we are bracing for crowds at our parks and public places. As you commemorate Memorial Day, I want to remind you to do your part to save lives, maintain social distancing. That means continuing to stand at least 6 feet apart when in public, wear a mask or face covering, and wash your hands. Stay home if you're sick or in the vulnerable populations with underlying chronic health conditions, or when you're around people over 65 years or older with underlying medical conditions. Today, in recognition of Memorial Day, I have invited Kelly Irving, the chief nurse at Michael E. DeBakey VA Medical Center. The VA nurses are on the front lines of the battle against the virus, and they are heroes working to save heroes in our hospitals. And let me invite Kelly Irving, the chief nurse at Michael E. DeBakey VA Medical Center. Kelly.
Thank you, Mayor Turner, for the invitation here today for your press conference. As you stated, I am the chief nurse at Michael E. DeBakey VA Medical Center, located in the heart of the Texas Medical Center. As we celebrate this month, was Nurses Month, and at the beginning of the year it was titled the Year of the Nurse. And what I will say to you as a nurse for a very, very, very long time, that my condolences go to you and to your family. We know what it's like. We have lost many. We lost one of our very own nurses at the organization. And although as a nurse we know it's real, it was extremely real to know that someone was at work one day and then in a couple of weeks they were no longer there. And by all means, it was a registered nurse. This is what we take our vow for, to care for others. But with this pandemic, I will say to you, it's like none other. Please be safe. As we honor our veterans this weekend, over the long weekend, please know that celebrations should not be as they were in the past. We really need you to physically distance yourself. We say 6 feet, but if you can do more, I encourage you to do more. We encourage you to wash your hands. Please wash your hands. That is one of the proven best defenses. If you don't have sanitizer, soap and water with a little vigorous rubbing will do for about 30 seconds. Clean all of your frequently touched surfaces and be mindful of your surroundings. At your gas stations, those areas where we know multiple people will touch pumps. And don't think that everyone is doing what you're doing. Go on and go the extra mile. Clean your vehicles, wipe your areas, social distance. And what do we mean by social distance? Staying away, but keeping in contact with people. We know that our veterans, many of them suffer with post-traumatic stress disorders. So to not have any contact with individuals really isn't healthy for them. So I'm here to say that our VA is open. We are open. We are not doing elective procedures, but we are there to provide urgent, emergent care to all of our veterans. Our 24/7 contact center is also open, and our crisis hotline is available. We want you to spread the word that we are here to take care of over 115,000 veterans as we do annually, but the care looks a little differently. We had moved a couple of years ago into the virtual world, the telehealth world. So many of our appointments now, the majority, as a matter of fact, are video contact or telephone. So I encourage you, if you know a veteran, reach out to them this weekend. Please share that we are here for them. Michael E. DeBakey is alive, breathing, well, and fully capable to take care of anyone that has the symptoms and that are COVID positive. We have seen some of our COVID positive veterans, but we're happy to say and fortunate that it has been less than 1% of our population, which is fantastic. But we are doing the social distancing in the hospital. We're not allowing many individuals into the building. We're doing screenings at every entrance. Every employee is screened, and that is to keep the veterans safe as well as the employees safe, because we need them safe and healthy to be able to provide the care. So I'll conclude with, we are here. If you should need us at any point in time, you pick up the phone and you can call our main line. We are available and here and ready to service. I do want to thank all of the veterans that are here and all of the healthcare workers and frontline employees, because you are truly our heroes. And I want to thank Mayor Turner again for inviting us and having the opportunity to recognize and acknowledge our veterans. Thank you.
Thanks, Kellen. We certainly want to recognize our veterans who have made it possible for us to be where we are today. Let me tell you, there are many moving parts as it relates to this recovery effort. There's the healthcare component. Then there's also the economic side. So it's a huge job, and it covers. And there are so many things that are happening at the same time, simultaneously. Marvin Odum is leading that recovery effort and working on both sides of the equation to help move this city forward. At the same time, working closely with the county as well. So let me call up now Marvin Odum, who's been also very instrumental, been a part of the testing and contact tracing initiative. Marvin.
Thank you, Mayor, and good afternoon, everyone. I'm happy to be here to present a bit of a Memorial Day message in the context of COVID-19. But of course, what I also recognize is you've just heard two of the most powerful messages that could ever be given from a family so severely impacted, and of course from the front line dealing directly with this disease and with our veterans. On Monday, we will celebrate Memorial Day to honor those who have sacrificed in service of our country. While we are living in very different times due to the COVID-19 pandemic, Memorial Day will remain a time for Houstonians to honor those that have fallen and to those that have been injured in the line of duty. We must always remember the sacrifices military service members and veterans have made to protect our country. On behalf of the people of Houston, we thank you for your service. As we pay tribute to our servicemen and women who dedicated so much to protect us from harm, we call upon Houstonians to honor their sacrifices by making the decision to continue to keep our community safe and to stand resolved in this battle against COVID-19. We have successfully kept the numbers of lives lost due to COVID-19 down in Houston. We have done this through physical distancing. Physical distancing has worked, so let's avoid slipping backward. As we reopen Houston, we must not let our defenses down. Honoring our heroes will look different this year, and we call upon Houstonians to show their appreciation of those heroes by wearing masks, by maintaining physical distancing, staying that 6 feet apart as we venture out, washing your hands frequently, and staying home if you feel sick or if others that you live with feel sick. And one important thing we're seeing about COVID-19 is that many individuals are infected, but they don't feel sick or have any symptoms. These individuals are called asymptomatic. Now, this is important because it means that your friends and your coworkers who look okay may be infected and can unwillingly infect you. Or, not knowing you are sick, you can infect other people in your family, work, or community. The only way to know if you're infected is to get tested. That is why we are increasing the number of testing sites around the city so that people can know their status and stay home when necessary so that they do not infect others. Now, you can see the testing sites on this map here on the screen, but more importantly, you can find this information on both the testing site locations and the hours of operations on the city's website. I want to reiterate what I said a couple of weeks ago, and that is that anyone, regardless of symptoms, can receive a free COVID-19 test at these city testing sites. Now, your actions in the coming days and months are not just to protect you and the people that are close to you, but also to protect those that you've never met and those that you may never meet, just like our veterans have done countless times in service to our country. The health and well-being of Houston will depend on the steps you take to contain the spread of COVID-19, and in the same way, your family's health will depend on the actions of others. Thank you.
Thanks, Marvin. And then lastly, the Memorial Day weekend traditionally marks the opening of 38 City of Houston swimming pools. Because of the health crisis this year, I've asked Parks and Recreation Director Steve Wright to keep the swimming pools closed for now as we evaluate the program, progression of this virus and look at the data. The city also will not open 27 splash pads located in some of our city parks at this time. I know that this decision may disappoint some families, but it is the responsible thing for the city to do. It is impossible to enforce social distancing in public pools and impossible to protect children and others from the viral spread. There is no vaccine and no cure for the coronavirus. And so I would rather be more cautious, especially as it relates to our children at this particular point in time. Let me call up now Director Wright to talk about some of the measures that will be taking place with Parks and Rec. Director Wright.
Thank you, Mayor. As y'all all know, this is a very, very busy weekend. It's a 3-day holiday weekend. There will be a lot of visitors out at our parks. A lot of citizens have discovered the 380 parks that we have, and we encourage them to continue to get out. The item that we want to continue to plead and implore is this is a shared problem. And the only way that we're going to be able to address this is if everybody views this as social responsibility. We encourage you to visit our parks this weekend. We will have park monitors. They will be out there to constantly remind people, please keep 6 feet apart. Please be aware of social distancing, wear a mask. But these park monitors and everybody out there that's reminding can only go so far. This is something that all of us as Houstonians, we need to embrace and understand that our actions affect the lives and actions of others as well. This is a social responsibility issue. Please get out, enjoy the parks. If you can walk to your park, we'd love to have you walking. Great way to get some exercise. If you can ride your bicycle to the park, we'd love to have you ride your bicycle. So please get out, enjoy these parks. It's a lot of fresh air out there. And as Mayor Turner alluded to, he is constantly, along with Dr. Purse and other medical professionals, monitoring the situation regarding the pools. The primary challenge right now is the social distancing. This is ever an evolving issue that continues to change. I will continue to provide Mayor Turner with the information in regards to what would be needed to provide a safe aquatic experience, whether it's at a pool or at a splash pad. So until further notice, as Mayor Turner stated, the pools and the splash pads will remain closed. One of the areas that we are going to open effective June 1st with restrictions, I say it again, with restrictions, all these restrictions will be posted and they will be online, but effective June 1st, we will open up all 3 of the city-owned and operated golf courses. That will be the golf course at Memorial, Sharpstown, and Melrose. All 3 will be open for play with restrictions. We will also open up our 3 large tennis complexes. We have a tennis complex at Memorial, tennis complex at Homer Ford, which is in McGregor Park, and we have the Lee LeClaire Tennis Center. All 3 tennis complexes will open up effective June 1st with restrictions. We are also going to open up, we have 5 disc golf courses that are out there. This gives people the opportunity, once again, to go out, practice social distancing, and enjoy the great outdoors. All 3 of these will have national standard restrictions that will be posted on site and will also be posted on our website. Please go to houstonparks.org, take a look at these restrictions. Please abide by these restrictions. As this information continues to roll in and we see people adhering to these different policies, we will continue to take a look at other areas within the park and recreation system to determine what and when and if these areas will be open for further use. Enjoy the weekend. Thank you.